Good to have you tuned in. This is the Daily Report for Friday, February 18th. Korea's daily COVID-19 tally has surged well above the 100,000 mark. We start with this tally and more. As always, I have Kwon Soa standing by. So just start us off.
All right, Sunny, let's start with that all-time high in COVID-19 infections that were recorded here in the nation this Friday. Let's take a look here. 109,831 cases were counted in the span of 24 hours as of 12 a.m. And that includes more than 109,700 domestic transmissions and 116 imported cases. And that has brought Korea's total caseload now to over 1.7 million, and deaths stand at 7,283, with 45 additional people who have lost their lives in the past day due to this virus. And if we take a look at our graph now, as you can see, for the first time, a six-digit figure here in the nation, with a rise from the 90,000s the 2 days ago. And also compared to last Friday, the caseload has roughly doubled. And now let's also take a look at our map, and we are seeing only Sejong City has a triple-digit figure, and across the nation we are seeing record high number of infections, over 36,000 in Gyeonggi-do province, more than 25,000 in the capital Seoul, and even here on Jeju Island we're seeing for the first time over 1,000 infections in a day. And now let's move over to the number of patients that are in serious or critical condition. That has been remaining in the 300s, here at 385 as of 12 a.m. On to our vaccination updates. 87.3% and 86.3% of the nation's population has received either their first or second dose, whereas on the booster shot front, now we've got a milestone here. 30 million people now have gotten their additional dose. That's more than 165,900 who got their extra shot a day ago. And moving on to the international numbers, around 2 million new cases of the coronavirus in the past day, and more than 12,400 additional fatalities. There were also some milestones hit in some specific countries. As you can see here, we've got Germany in the past day surpassing 13 million cases, and France 22 million infections. And now also here, Indonesia has become the 12th country in the world to surpass the 5 million mark. And those are the general updates I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for now. Right, here on the local front, as mentioned earlier this week, authorities have shared a few changes to social restrictions on this Friday. Shin Yeon is here with details on that. Yeon, welcome back.
Thanks for having me, Sunny.
Right, let's begin with the shift then.
Right, so the Prime Minister announced in a briefing on Friday that a change in our distancing measures that will take effect starting this weekend. Contrary to recent speculation, social gathering caps will stay at a maximum of 6 people. The only change is that businesses will be allowed to stay open until 10 p.m., a 1-hour extension from the current 9 p.m. rule.
We've decided to maintain the current framework of social distancing, but slightly adjust some measures in consideration of people's livelihood and our medical capacity.
And this is because we recently saw a big jump in the number of cases. As Hoa mentioned, Korea reported yet another record high daily figure on this Friday at nearly 110,000. The country's updated social distancing guidelines will last for 3 weeks starting tomorrow. And before Friday's decision, Korea's Special COVID-19 Transition Committee had gathered to discuss whether easing restrictions would be a step in the right direction. While economists and business owners said social distancing measures should be eased immediately, officials working on the medical front said now is not the time. Those who are opposed to easing said if restrictions were to be lifted, our case counts may skyrocket, creating a situation that the government isn't prepared for. And this is actually the prevailing opinion right now among many health experts.
We'd be risking too much if we ease measures right now. Measures need to be eased after we confirm the surge has come down and we're certain that our medical capacity can handle the situation.
Right, and staying with that cautious stance, I understand the Prime Minister has also maintained the government's support for vaccine passes, Yeon.
That's right. He didn't sway too far from an earlier comment made by senior health officials Hon Young-rae, who said vaccine passes remain essential in our containment strategy. Prime Minister Kim Bu-kyum said they will continue to be used at most facilities for now, but the possibility of scrapping vaccine pass requirements is still on the table for Korean health authorities. Also, as Hon Young-rae had hinted earlier this week, starting tomorrow, which is a Saturday here, QR codes will only be used for vaccine verification instead of visitor record keeping. This is part of the government's move to discontinue active contact tracing, and the government has also put on hold the extension of vaccine passes to children aged 12 to 18, which was originally scheduled for March. But following Friday's announcement, vaccine passes for teens will be further pushed back to April 1st. Now, this comes as health authorities are still waiting on a final ruling from the Seoul Administrative Court regarding their appeal against an injunction which was granted to suspend the government's vaccine pass mandates on teenagers.
Right, yeah, and what looks to be the fate of our social restrictions, perhaps post-COVID, post-Omicron, that would be?
Right. The Prime Minister said social distancing measures would be eased once the surge is contained. In order for that to happen, we would have to see the peak of the Omicron wave first.
According to experts, we may see Omicron peak by the end of February or mid-March. After that, we'll see Omicron cases go down and then be able to ease social distancing measures like other countries have so that people can return to normal life.
In order for this to work, the Prime Minister called on the public to get their booster shots if they haven't done so yet. The Prime Minister noted how Omicron hasn't triggered a drastic increase in the number of deaths and critically ill patients in Korea, with more than half its population having received their boosters. Also, from next Monday, those over 18 who haven't been fully vaccinated can book their Novavax shots, which will be the first administered on March 7th. And these vaccines will also be used as boosters and mix and match shots.
All right, yeah, and thank you for now, but do stay behind for broader talks. Up next, we bring you the latest government remarks regarding Korea's Omicron outbreak. Right, so tell us about that.
Right, Sunny. Well, with this new milestone, everyone wants to know when and by how much Omicron will peak here in Korea. And experts have been suggesting new figures, like Yeon mentioned also yesterday, around 270,000 could be the peak, for instance. Now, new estimate has been released by the government this Friday, but instead a rough assessment on when the peak could come.
When it comes to the timeline and scale over Omicron peak, there are many uncertainties that make forecasting difficult. That being said, a number of experts in the civil sector have published simulation models that predict our Omicron peak to occur sometime in late February or early March. The government is hoping that will indeed be the case, and that our outbreak will reach its peak within the next 3 weeks, while our new social distancing guidelines are in effect.
Citing recent expert forecasts that say by February 23rd, infections could hit around 130,000, and by March 2nd, roughly 180,000, there is a possibility that the number of patients in severe or critical condition rises to above 1,000 and to a maximum of 2,500. One official said even when considering the roughly 2 to 3 week lag in the number of patients that develop serious or critical symptoms, currently that number appears to remain at a low level compared to the fast rise in daily cases. According to an official, around 2,000 patients in severe or critical condition can be managed currently, and up to 2,500 is also expected to be capable given the continuous expansion of ICU beds since late last year. The government has also expanded medical facilities in charge of taking consultations from relatively low-risk patients being treated at home in the past few days. An additional 37,130 people have been designated for home treatment a day ago, raising the total to close to 352,000.
Now, so as you mentioned, with many predicting the daily tally is bound to surge in the days ahead, questions are being raised about the recent decision with regard to our social distancing restrictions that Yeon mentioned earlier, right?
Right, Sunny. The one question being, is the latest decision made by the government actually an easing or not? Now, while it is an extension of recently strengthened measures, the one key change this time is the lengthened operation of business hours by 1 hour to 10 p.m., which is why some people are worried that this could give a false signal that the current situation is less severe than before. However, officials made clear that that's not the case, asking the nation's people to remain vigilant. Lee Gi-il, a health ministry official, said that the government made a minimal adjustment in consideration of business owners and the economy, and that during discussions, some officials even suggested scrapping business hour restrictions altogether, but explained the government decided on a more conservative approach to the situation that is, and authorities suggest that easing further restrictions will only be likely once Korea is past its Omicron peak, and also echoing what we earlier heard by Prime Minister Kim Boo-kyum, his words.
Right. So, and on the testing front, I understand PCR testings are also being expanded.
Right, Sunny. Although the government recently has been focusing its testing system on the rapid antigen testings, it has also increased its PCR tests. Now, with the soaring figures, an average of around daily 600,000 PCR tests are being conducted. Even around 680,000 tests were conducted on Monday alone. And there's also going to be an expansion in who's going to be subject to PCR tests. So not only those aged 60 and above or those that are vulnerable, but also if schools see it necessary, students can also get PCR tests. And beginning on Monday, also one guardian of a person who has to take care of a person being hospitalized can get a PCR test for free.
Right, and staying with testing, so let's now include Yeon in our talks. Yeon, I understand a group of local researchers have come up with an easier way to test yourself for COVID-19. Tell us about that.
That's right. So testing yourself at home isn't as easy as it sounds. Though you can get the results within 15 minutes, you have to be the one pushing a long swab up your nose and twisting it to collect your sample. And that's why researchers here in Korea have come up with a new COVID-19 testing method that uses a gargle solution. All you need to do is gargle the solution for 2 minutes, then split some of the fluid onto a testing device. This liquid is made from bean extracts, which contains a special type of protein that can easily pick up any viruses that are present in your mouth. And this gargle solution has already been tested on some 200 people, and it was shown to be nearly 98% accurate. And as soon as it gets the green light from the Ministry of Food and Drug Safety, it will then be produced and distributed to the public.
Right, I suppose a gargling method would be much more convenient than like having to put the cotton up your nose, right? Now, moving from testing to treatment, so I understand some in the US are calling for more efforts on the treatment front. Tell us about that.
Right, Sunny. According to a report by the American Chemical Society on infectious diseases, and also a modeling by the Journal of Chemical Information based on artificial intelligence, Omicron and other COVID-19 variants are evolving, and that with an increased infectivity and antibody escape. So Omicron, they got some new figures here, is 10 times more infectious than the original strain and 2.8 times more than Delta. Also, it seems that it's 14 times more likely than Delta to escape existing vaccines. And that's why these researchers say that new vaccines and new antibody therapies are desperately needed.
Right, and hopefully they'll be available in the near future. All right, so as always, thank you very much for that. See you on Monday. Yeon, have a safe weekend. See you next week.
Thank you so much.
In our news segment on this Friday, we start with a commendable performance by a pair of Korean female figure skaters Thursday night at the Beijing Olympics, who both finished within the top 10. Our Kim Dami has the highlights.
South Korea's Yuyoung-owned figure skating rink on Thursday is securing 6th place in the women's singles competition. After opening the performance with her strongest move, the triple axel, Yu received the maximum level 4 scores on her step sequence and spins. Performing to Les Miserables by Claude Michel Schamberg, she scored a 74.16 for the technical element score based on jumps and other elements of her routine, and 68.59 in the program component score, which assesses choreography and artistry. When combined with her 4th place finish in free skating on Tuesday, this left her in 6th place overall with a total of 213.09 points. Kim Ye-rin finished in 9th place with a total score of 202.63 points. This is the first time 2 South Korean figure skaters have made it into the top 10 at the women's singles at the Olympics. 2 skaters representing the ROC topped Thursday's competition, and 15-year-old Kamila Valieva, the center of a controversial doping scandal, fell twice and stumbled into 4th place. The award ceremony did take place as planned after the IOC made it clear earlier this week there would be no medal ceremony during the games if Valieva finished in the top 3. Kim Da-mi, Arirang News.
In other news, a war of words continues between Moscow and Washington amid tensions over Ukraine. Our Kim Hyo-san covers the latest events on that front.
The Organization for Security and Cooperation in Europe monitoring mission says tensions in eastern Ukraine may have eased somewhat in recent days. However, the head of the OSCE Special Monitoring Mission in Ukraine said some 500 explosions were recorded between Wednesday evening and Thursday morning. This comes as Russian-backed separatists and Ukrainian government forces traded accusations of firing shells across the ceasefire line in eastern Ukraine in what Kiev said appeared to be a, quote, provocation. As tensions simmer, U.S. President Joe Biden on Thursday warned the threat of a Russian invasion is very high for numerous reasons.
Very, because they have not moved any of their troops out. They've moved more troops in. Number one. Number two, we have reason to believe that they are engaged in a false flag operation to have an excuse to go in. Every indication we have is they're prepared to go into Ukraine, attack Ukraine.
However, President Biden insisted there was a diplomatic path to resolve the crisis. He said this is what his top diplomat told the UN Security Council. In a surprise appearance at the UN on Thursday, U.S. Secretary of State Antony Blinken laid out the potential steps U.S. officials expect Moscow could take.
Russia plans to manufacture a pretext for its attack. This could be a violent event that Russia will blame on Ukraine, or an outrageous accusation that Russia will level against the Ukrainian government.
Criticizing Washington's rhetoric, the Kremlin expressed concern over the escalation of tensions that it says are partly inflamed by comments made by the West. Moscow decided to expel the U.S. Deputy Chief of Mission to Russia without elaborating on why. Russia's foreign ministry also called on the U.S. to stop supplying weapons to Ukraine. In a written response to Washington's security proposals, Russia outlined a series of demands it says need to be met in order for a de-escalation. These include the withdrawal of Western military advisors and instructors from Ukraine. In Europe, EU leaders showed unity on implementing tough sanctions on Moscow should Russia invade Ukraine. At a summit Thursday, the 27 EU leaders discussed diplomatic ways to try and resolve the standoff. Kim Hyo-san, Arirang News.
And amid the possibility of a military confrontation in Eastern Europe, industry insiders here in Korea have shared their thoughts on the potential toll of such a scenario on the country's overall trade. Our Kim Sang-min reports.
The growing tension between Russia and Ukraine could take its toll on South Korean firms, possibly causing disruption in trade. In its latest report, the Korea International Trade Association warns that any escalation in the Russia-Ukraine crisis could see Korea's exports to Russia take a direct hit. In the wake of the annexation of Crimea by Russia in 2015, South Korea's exports to Russia dropped more than 53% from the previous year. Currently, Russia is South Korea's 10th largest trading partner, and the report suggests hundreds of exporters and importers in the country, especially those in cosmetics and auto parts manufacturing, could be affected. However, in the bigger picture, the impact of the tensions on South Korea as a whole in terms of trade and supply is somewhat limited. While South Korea imports more than 2,400 items from Russia and Ukraine, there are just 50 items where Korea has a more than 70% reliance on those countries. Experts point to the indirect impact, however, as it could further accelerate the already high inflation, which could in turn put a damper on businesses.
If armed conflict breaks out in Ukraine, there may be a very high rise in inflation, especially oil prices, not because Ukraine is a major oil producer, but Russian exports of oil goes through Ukraine to Europe and other countries.
Possible international boycotts against Russian oil could further push up the already high oil prices, with some analysts expecting it to hit $120 per barrel or even higher. The expert also added that prices of grain could rise globally as Ukraine is a major grain exporter to many countries, especially Europe. 김성민, Arirang News.
Staying with economy-related news, export and employment numbers are holding steady, but authorities believe Omicron and geopolitical concerns may serve to challenge their stability. Ji-young has more.
South Korea has seen solid growth in exports and employment figures are recovering. Finance Ministry's monthly economic green book shows that exports in January came to $55.3 billion, up by more than 15% on year. Last month's increase was mainly on the back of solid outbound shipments of 14 out of 15 major export items. Exports of petroleum products surged by almost 90% and computers jumped by 50% on year. Semiconductors grew by around 24% compared to the same period the year before, standing at around $11 billion last month. There was also improvement in employment figures, with the biggest on-year job growth in 22 years posted in January, bouncing back from low numbers the previous year. The number of workers in the country was around 26.95 million last month, up 1.14 million, or more than 4% from a year ago. The bumper figure comes as the country saw huge job losses in 2021, with almost 1 million jobs lost due to the fallout from the pandemic. However, despite solid exports and employment figures, the report noted that uncertainty remains high as the economy continues to face Omicron risks and surging inflation. Consumer prices in South Korea have risen more than 3% on year for 4 months in a row. The CPI rose above 3% in October for the first time since 2012, far higher than the government's target of 2%. The report also highlighted the risk of slowing domestic demand due to the COVID-19 surge and geopolitical risks from abroad, including the Russia-Ukraine crisis. The government said it'll go all out to stabilize consumer prices, manage risks both at home and abroad, minimize economic damage from COVID-19, and support economic recovery. Ji-young, Arirang News.
On a light note now, let's take a moment to appreciate Korea's traditional attire, the Hanbok, whose beauty reportedly lies within its colors and lines. Our Kim Bo-kyung explains.
Vivid and strong colors, but not overbearing. This is Hanbok, Korea's traditional attire, often called an integral part of Korean lives for centuries. It has been part of Korea's culture since before the Three Kingdoms period, and for hundreds of years our ancestors have worn this two-piece outfit, which is different from other countries' traditional clothes such as China's qipao and Japan's kimono. Its colors and lines. These are what an expert described as Hanbok's biggest uniqueness and its own beauty. Colors are from natural ingredients, flowers, roots of fruits, and leaves, and so they are soft and delicate.
Our ancestors matched these colors harmoniously. They used complementary colors for the outer fabric and the lining. For example, if the outer one is red, the inner will be blue. Two transparent but different colors will be matched and make another beautiful, new but natural color. The lines of the sleeves inseam, the skirt's pleats while moving when wearing hanbok are another mesmerizing aspect too.
Renowned Hanbok designer Park Sul-lyo says appreciating its beauty is one thing. Another is learning how to wear it.
네, 제가 지금 이 한복을 입었는데
네.
어떤 것들을 입은 건가요?
지금 예쁜 속바지를 비단 속바지를 입었고 버선을 신었고요. 그 다음에 속치마를 입었습니다. 그런 다음에 이제 마무리로 겉치마를 입었는데 옛날에는 한 7가지 정도를 속옷으로 입었다고 해요. 근데 지금은 그렇게까지는 할 필요가 없고요. 그리고 옛날에는 속저고리를 입었는데 지금은 속저고리를 입지를 않아요. 그냥 속저고리 입지 않기 위해서 이렇게 다 살갗에 다도 부드러운 비단을 안에다가 다 넣거든요.
Vibrant colors and simple curved lines are enough to steal artists' hearts and turn Hanbok's beauty into their own. Dubbed 21st century genre art, artist Kim Yeon-jung shows her free-spirited and bold characters, reviving Hanbok as a beautiful yet refreshing attire for the modern day. Hanbok has also inspired street art. A South Korean graffiti artist based in the US is best known for photorealistic murals of African-American women in traditional Korean hanbok. Knowing South Korea's cultural heritage and further expanding its boundaries could be the first step in learning to appreciate its beauty. 김보경, 아리랑 뉴스.
In this week's Global Focus, we turn to neighboring Japan, where Prime Minister Fumio Kishida has announced plans to ease the country's stringent COVID-19 border controls. For more on these plans and other issues, I have Walter Sim live on the line. Walter, it's good to speak with you again.
Thanks for having me.
Right, let's begin then with Japan's official assessment about its Omicron outbreak, Walter.
Sure. Well, in Japan, the COVID-19 case tally remains very high, and there were more than 95,000 cases nationwide yesterday. This comes after the country recorded for the first time on February 5th, more than 100,000 cases in a single day. Well, some experts, however, have started to point out that the spread appears to have peaked out, and I do think that there is some basis behind this. So the 7-day average of COVID-19 cases has fallen in as many as 36 out of Japan's 47 prefectures, including in Tokyo, where the average is now 83.7% that of last week, despite the capital recording nearly 18,000 cases yesterday. But despite the positive message that the government is trying to send that, things are under control, I think the health authorities also cannot overlook the fact that hospitals continue to be under a lot of strain here, despite the fact that Omicron is said to be a milder variant than previous variants in the past. This month is on track to be Japan's deadliest month for Japan since the COVID-19 pandemic began 2 years ago. And even though most of the fatalities are amongst the elderly, in one tragic case last week, a male teenager in Saitama who was recovering at home died after his condition took a sudden turn for the worse, and after he was turned away by as many as 10 hospitals. So all this goes to show that Kishida really faces a tough balancing act between managing public health interests as well as the economy, which has really sustained quite a blow with under the prolonged COVID-19 pandemic.
Right, Walter. Walter, Japan is currently one of the most difficult countries to enter, as authorities have virtually banned the entry of non-resident foreigners amid the pandemic. But this border control, like I mentioned earlier, is looking to be lifted in the near future, right?
Yes, that's right. And under this new measure that was announced yesterday, from March 1st, Japan will allow in the new entry of travelers for the purposes of work and study, but not yet for leisure, unfortunately. So indeed, there has been a lot of global attention on this relaxation, but But that, I think, overlooks the fact that, this measure really hardly shifts the needle. So what is going to happen from next month is that Japan will be raising this limit of arrivals at immigration to 5,000 people a day from 3,500 people currently. And it's also important to note that this figure will include returning Japanese citizens as well as other foreign residents who are already visa holders here. So official data from last month shows that more than 400,000 people are on the wait list to enter Japan as of last month, and at a rate of 5,000 people a day, including a number which also includes returning Japanese citizens, I must add. It will take months for this backlog of visa holders to sufficiently be cleared. So Kishida says that, the move to ease measures now is not really due to international criticism, but because it was time to prepare Japan for what he has termed a new phase of reopening. But of course, I think we have to see this as a monumental step for Japan, given that, Japan has come under sustained pressure both from foreign chambers of commerce as well as from domestic business lobbies like the Keidanren, who has warned of an irreversible impact on Japan's soft power as well as on Japan's international standing were the ban to continue for even longer. So I think it will be interesting to see how the measure will be accepted by the Japanese public, even though I don't think it's going to be that controversial since Kishida is taking a very staggered approach rather than, opening up the floodgates.
Right. And beyond the pandemic, Walter, on the diplomatic front, what looks to be the future of Seoul-Tokyo ties amid the latter's intentions to include a controversial mine on UNESCO's World Heritage List?
That is really a very tricky and dicey issue, and I think the future trajectory of bilateral ties between Japan and South Korea really depends on the approach taken by whomever becomes the next South Korean president, given the elections are looming in South Korea. And the nomination of the UNESCO heritage site, I think, will most definitely bedevil bilateral ties since both countries already harbor quite a lot of distrust for each other. But here in Japan, I think policymakers and as well as diplomats really see that the ball is in South Korea's court, because Japan has been very upset by how South Korea treated the 2015 Comfort Women Agreement. And Japan thinks that South Korea's protest against the nomination is rather irrational since, Japan's position is that it's seeking recognition for the mines up to the Meiji Restoration in 1868. It says that the mines are, objectively speaking, worthy of this UNESCO heritage since it was once the world's largest producer of gold, as well as the mines were the site of advanced industrial technology for its time. But of course, from a neutral point of view, I think South Korea has reason to distrust Japan's efforts to seek nomination, saying that Japan has a precedent in not sufficiently explaining the role of wartime labor at the Hashima Island when that was granted UNESCO status. So really, I think it's going to be very complicated road forward, and it remains to be seen how the next president of South Korea navigates this minefield.
Right, we'll just have to wait and see then. Meanwhile, Walter, a team that is from the International Atomic Energy Agency earlier this week began its review of Tokyo's plan to release radioactive water from the damaged Fukushima nuclear power plant into the Pacific Ocean starting around spring 2023. What is the latest on that front, very briefly speaking?
Well, yes, the IAEA is in Japan, and it's due to wrap up the visit today. They are scheduled to actually discuss the outcomes with the media later today, so I'm not quite clear what they have discovered at this point. But briefly speaking, I think it is going to be very likely that the water will be released as scheduled in spring next year. Japan says that the water is being treated to extremely strict standards far beyond what is required internationally to remove all harmful radioactive substances, except this particle called tritium, which Japan says is a routine byproduct of all nuclear power plants across the world. But I think the bigger picture issue is that even if a neutral party like the IAEA gives its backing to Japan's plan, there might continue to be a lot of distrust around the world over how Japan is handling the dicey Fukushima issue. And I think that no matter how many safety tests are done, if people don't feel this sense of security or don't trust Japan's actions, that it's going to be quite difficult to navigate. And domestically, there are a lot of concerns, rightfully, amongst fishermen who have worked very hard to rebuild their lives since 2011, and they fear that going forward, even if their food is proven to be safe, rumors would get in the way and spread both at home and abroad and hurt their livelihoods once again. So I think this is going to be quite politically controversial, and Japan will have to handle this issue very delicately, I think.
Right. All right, Walter, as always, thank you very much for your time and your thoughts.
Thank you so much.
Korea's daily tally has hit above 100,000 on this Friday, and pundits are claiming that the tally will reach higher numbers in the near future. For more on the domestic COVID-19 situation and efforts to address it, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Dr. Kim, it's a pleasure to see you again.
Good afternoon.
I also have Dr. Son Ho-jun at Johns Hopkins University, who is currently in Daegu, live on the line. Professor Son, it's great to see you again.
Hi, Sunny. Thanks for having me back.
Right. Dr. Kim, how would you describe Korea's current COVID-19 situation?
Well, to answer that question, I think we have to first look at the situation in foreign countries, including the U.S. and then the European countries. And I don't know if this is fortunate or not, but that those countries are actually experiencing the Omicron surge just beforehand, and then we actually can just learn from their situation. And actually, their situation help us to just predict what we will experience in the near future. And then those based on those situation, our situation seems to be, at least the number of just confirmed cases are still just escalating right now, and then we're not for sure when we will actually reach the peak of the infection cases. So that's the current situation that I just know so far.
Right. And Dr. Son, the number of critical cases is also growing, albeit at a slower pace than the number of daily infections, of course. And authorities claim the medical arena can accommodate 2,000 ICU patients. What are your thoughts?
Yeah, so certainly as we see more cases, and the cases are increasing at an exponential rate, we expect to see the people in a critical ill phase and people dying will increase as well. These numbers will lag about 3 to 4 weeks. So we will see how this will accumulate. But the Korean government has set up a capacity to have about 2,000 to accommodate about 2,000 critical patients, and we're still at a very low levels in terms of reaching that capacity. So I think we're in a good controlled state. But again, I think this is also attributable to having plans for a lot of people who are asymptomatic, who have lesser of the illness, taking care of themselves at home, waiting out to have the illness pass by. So we have to kind of be a little bit cautious with this approach at this stage.
Right, we do need to be cautious then. Dr. Kim, there are also conflicting calculations about Korea's Omicron peak, with some saying early March with 200,000 daily infections and others betting on mid-March with 270,000 daily cases. Where do you stand?
Well, first of all, just this kind of prediction is really difficult. Some say from this modeling and the prediction, just professionals, they even say the prediction just way beyond 2 weeks after this is really just difficult. And then there are a number of just some variables that actually just affect sort of just the prediction. I mean, just early in the COVID-19 pandemic, the prediction was really just a little bit just easier because every person was just very naive in terms of immune status. Nobody was actually immune to this virus. So then the prediction was sort of just a very straightforward, and then just less number, just a smaller number of variables. But now we have, well, the virus is Omicron. There's no more just variable in this case. Just Omicron is just a predominant. But there are some immune status are quite different. I mean, just for people to people and then country to country, because now just some people are actually just immune by just a natural infection, and others are just immune by vaccination. Even for vaccination, different kinds of vaccine, just platform technology, so the immune response is a little bit different. And also depending on how many shots the people just get, whether it's a primary shot series or just a booster shot series, the immune status also different. And also this prediction can be affected substantially by our social distancing measures. And then this will actually affect our human behavior. So anyway, just whatever the prediction is correct. I mean, the current situation, everybody just agrees that the numbers will increase, and then whether it is just a sharp increase or just like a broad distribution, we will see in the future.
We'll just have to wait and see.
Sure,
then.
yeah.
Dr. Son, the daily tallies that Korea has been witnessing in recent days are unprecedented, and they're bound to be causing quite a bit of concern for some people here in the country. What are your words of advice to them?
Right. I would say it's unprecedented everywhere else. You see U.S., you're seeing these numbers at an unprecedented rate, but also at the same time, it's declining at a very unprecedented rate without additional lockdowns or very stringent measures. I think with this virus, right, the Omicron and the additional variant, we know from the beginning the biological properties, epidemiological properties have the right case to have these transmission occurring much at a higher rate. And we're just seeing that at the end of the day. What I want to iterate here is that, and I've iterated before, and other experts have iterated well before as well, except for the very beginning when we didn't know anything about COVID, is that, number of new cases are very important indicators to understand the overall disease burden and the burden to the health systems and the society. But what's more important is how many people of these new cases ending up in more severe disease state requiring ICU, and then ultimately resulting into death. What we're seeing overall across the globe and in Korea, we'll see, is that the number of people ending up dying due to COVID is sort of stabilizing. The absolute number is increasing, but that's again is associated with the sheer number of new cases that we're seeing, and then we're also seeing that the number of hospitalizations are not significantly increasing. But again, this is also associated with how many people are actually protected and adherent to mask wearing policies. And in the US and UK, they're not, but in Korea, we're very, very good about wearing masks and being vaccinated. So in terms of new case numbers, we should be concerned, but we should not be fearful of these new numbers. It's inevitable that the virus itself is very transmissible, so we'll see more new cases in the coming weeks.
Right. And meanwhile, Dr. Kim, against the backdrop of nearly 110,000 new infections, if you're talking about this particular Friday, authorities have allowed for a slight ease in social restrictions within drinking and dining establishments, allowing them to stay open until 10 in the evening. How do you respond?
Well, I think but personally, I thought that this is kind of just a very minimum just a change, just considering the current situation. But anyway, just the governments and then the experts, they actually just weighing just the two main factors. One is the just controlling the number of just severe cases, not the total just case numbers. And the second one is how we can just reduce the socioeconomic burden, especially for the small business owners. And they're just weighing between just the two factors. And I think just the government just actually chose this minimum just to change compared to our just current measure of the social distancing guidelines.
Right. And staying with social distancing guidelines, Dr. Son, what are your thoughts on the fate of Korea's distancing measures after Omicron?
Yeah, so I think it's very difficult to make any significant change at this time. Again, because the virulence and the transmissibility of the virus, it's beyond definitely the levels where we can control to have a zero transmission, right? We originally thought we could, but with each variant arising, and increase in transmissibility properties, it's inevitable that it's very difficult for us to control and be very restrictive. And also at the same time, there are now studies showing that with other disease as well as just socioeconomic status and issues, more stringent social distance policies, lockdowns, will likely have much more adverse events than in the consequences due to COVID transmission itself. And so it's relatable to all of the disease severity, the issues that we currently already have. And I think it's okay and it's right for the government to just see how things are going, but not lay off all of the restrictions down, because we actually don't know how this virus will behave. And just to give a UK example, where it seems like it was coming down rapidly, it's being very stagnant, right? So the government has all the rights and evidence to be cautious about adjusting social distance policies at this time.
Right. And staying with restrictions, Dr. Kim, the QR code-based registration requirement here in the country is also looking to be lifted. What are the implications of this measure?
Well, this is one of the way to just trace the contagions, just infection, the series of infection. And this is one of the big T's out of just three. One is just a test and the trace and then treatment. And we cannot actually just rule out this kind of just one of the big T, because this is just an essential part of just the current measures. So the shift is just reflecting just some current situation. Now we are experiencing more than 100,000 new cases of infection. So now just the epidemiological investigator cannot just follow up all those the tracing issues. So then now just actually shifted to the sort of just a self-report. This is very much just as a voluntary reporting. And then maybe we are actually expecting maybe people just infected by the virus now just report the voluntary, and also just let other people they actually just contacted after the exposing the virus to prepare, and then themselves maybe just the testing for just COVID-19 and things like that.
And what are your personal thoughts on that regarding the safety of such a shift in measure to allow people to voluntarily report their whereabouts and contacts?
Well, I think they need to be just the first was just well informed, because previously all the governments sort of just take care of all those just a very tiny just little things. But now the responsibilities are really just shifted to the people themselves. So they need to get just well informed, whether it is just any other direct contact phone number or just internet or just websites, things like that.
Right. Dr. Sun, being eligible for a PCR test has reportedly become tougher here in the country, and most are recommended to receive a rapid antigen test whose accuracy has been disputed in some cases. Now, accordingly, some believe the actual number of infected individuals, including a large proportion of asymptomatic patients, may be higher than the current tally. Do you agree?
Yeah, so in terms of the move to restricting PCR test usage, of course, people definitely, if they can pay for the PCR, I think they can get PCR tests if they need it. The free PCR test that's part of the government program and part of conduct investigation, I think it's the right move, because we are seeing huge restrictions in terms of resources that we can use to find cases at this time. The sheer volume of people that needs to be investigated is just too high. So the government needs to be strategizing the best way to utilize our PCR test capacity. So this is the right move. In terms of your second question, yes, because we're restricting to those who are extremely needed to get PCR tests to be confirmed as COVID-19 cases, we're likely going to not capture all of the prevalent cases. But this is the state of affairs with the pandemic, the Omicron surge around the globe. It's going to be very difficult to find every single cases. We have to be relying on people voluntarily testing themselves, being alert and vigilant about their own health status, and then so that they're not jeopardizing their own health, but also not jeopardizing other people. But again, there are going to be a lot more unrecognized infections for sure. This is part of the process. What hopefully is fortunate thing is that the severity of the disease that we are seeing with Omicron is not as significant as we have experienced in the earlier variants. So that's what I think the decision was for the government to move towards this direction.
Right. And Dr. Kim, some regions have been recording an alarming number in breakthrough infections among the elderly at healthcare facilities. Now, the elderly that received their booster doses back in November, are these cases reflections perhaps of waning protection?
Yeah, that's true. And then this situation actually reminds me of the last November situation, that when we actually started living with COVID-19. That time actually, one of the things that we did not expect that time is, there was actually time reaction, but then suddenly we actually witnessed just increasing number of infections, especially in the nursing hospital and the nursing homes. And then the reason is that the people residing in those facilities are very vulnerable to the infection. They are basically have very weak immunity. So then and also governments and even experts did not expect such kind of situation, because we did not actually understand completely about the some immunity conferred by our vaccination. But then we realized that maybe the cellular immunity is still fine, but antibody response is just waning over a period of time. So then that government now also other countries just started some booster shot program. But then even after booster shot, now the experts agree that the antibody elicited by the vaccination is lasted 3 or 4 months. And then even the antibody now raised by the vaccination is not really specific for the Omicron, the spike protein. So now the specificity of the antibodies is still just lower. So then now we are seeing the breakthrough infections, especially in these elderly people. And so that's why the government now recommending the second booster shot for these the vulnerable people. And then regarding this booster shot program, there was some very interesting the report about the where actually SOA mentioned about the some updated vaccine, and then the Moderna has actually developed the Omicron specific the vaccine, and then tested those the booster shot for non-human primate. So those non-human primate, actually the primates actually experienced already 2 shots of Moderna vaccines. Then for the booster shot, the scientists tried 2 different booster shots. One is the vaccine with the original, the original vaccine, and the second one is the actually Omicron the specific vaccine. Well, interestingly enough, the result was almost the same. Whether we actually administer the Omicron specific vaccine or the original old vaccine, the protection efficiency seems to be very similar. So that's kind of update.
Dr. Sun, the quarantine period for COVID-19 patients was recently shortened to 7 days from 10. But given the potential disruptions to essential services and work within the community, as many become infected, there are calls for the isolation period to be further shortened to 5 days. Very briefly speaking, are these calls practical in your view?
Yes, I think they are. And first of all, again, I think it's practical because it's just sheer volume of new patients that people can manage with very strict quarantining observation is going to have already passed. So, 5 days or 7 days, it's just going to be just numbers at this stage. I think it's shortening will definitely take a lot of burden off from businesses and people themselves as well. The psychological burden of being quarantined and being very restricted for 7 days is much less for 5 days, right, compared to 7. So I think the ultimately we'll move into shortened quarantining. And then, but again, we will have to wait and see where I think the government is buying the time. We need to buy a bit of time to make sure that we have the strong evidence to move towards the shortening of the quarantining process so that we can adjust ourselves to a potential, unseen infections that could be transmission that we can't observe and limit those, the consequences from those.
Right. I see. All right. Professor Son, as always, thank you very much for your thoughts. Dr. Kim, here in the studio, thank you very much for your insights today. Right. That brings us to the end of this edition of the Daily Report. We'll be back next Monday. Have a safe weekend. Thank you for watching.